Hello and welcome. This short presentation is on fundus fluorescein angiography procedure. Fundus fluorescein angiography is an invasive technique to study the flow of sodium fluorescein dye through choroidal and retinal circulation. The dye is injected intravenously, followed by capturing of images using a fundus camera. The majority of the dye remains within the blood vessels in a normal individual because of the integrity of blood-retinal barrier. The fundus fluorescein angiography is based on the principle of fluorescence, wherein the fluorescein dye absorbs the short wavelength blue light and emits the long wavelength yellow-green light. This picture is of the procedure of fundus fluorescein angiography in progress. You can see the assistant holding a syringe filled with the dye, and the consultant is capturing the images using a fundus camera, as shown with the red arrow. The fundus fluorescein angiography can be divided into 5 phases. The first phase is pre-arterial phase, wherein the dye enters and fills the choroidal circulation. The arterial phase is characterized by filling of the retinal arteries. In arteriovenous phase, the dye starts filling the retinal veins. And in venous phase, the entire venous tree gets filled with the dye. And the last phase is the recirculation phase. This picture is of the late phase of the angiogram, showing the retinal blood vessels filled with the dye. And this dark area is showing the foveal avascular zone, and it demarcates the macular area. The fluorescein angiography is commonly indicated in patients of diabetic retinopathy, retinal vein occlusion, age-related macular degeneration, central serous chorioretinopathy, and in inflammatory conditions of retinal blood vessels. The abnormal fundus fluorescein angiogram can be either because of hyperfluorescence or it may show hypofluorescence. Hyperfluorescence can occur due to leakage or pooling of the dye or due to staining of the tissue. This angiogram is showing mottled hyperfluorescence involving the foveal avascular zone, as shown with the yellow arrow. The hypofluorescence can be because of blocked fluorescence or due to filling defects. This is an angiogram from a patient of infratemporal branch retinal vein occlusion, and it is showing blocked fluorescence as depicted with red arrow. I thank you very much for your attention.